We truly believe that when we nurture each other, when we lift each other up, when we share our successes as much as we share our failures, that's exactly what training should be. It's exploration of your own self.
I was looking for a place that was a good learning environment to become a neurologist, and I felt like the vibe that I got from both the residents here and the faculty here was that this was a place where you could not only learn neurology, but be free to make the mistakes that you need to make to become a competent doctor, and people would accept you and help you improve on those mistakes with the goal of making you better.
North Carolina is one of the states in the country where a lot of people have strokes, so we see a lot of patients with stroke. And we really, really want to be sure that every resident who comes through this program leaves this program an expert in the acute care of a patient with a stroke. And so to do that, we actually have set up a system where we put them on the front lines, but with a graded system of support during the years they're here. Compared to most programs, residents are not allowed to do that without running it by somebody senior. In many programs, even the stroke fellows who are training to do this have to run it by. I have to say that by the time they get to be at the end of that PGY 4 year or even halfway through it, they do this very, very, very well.
I think that residents who would really be excited about being specifically at UNC for their training are the ones who are excited about a rapidly changing landscape in their specialty. That we can't expect that our careers will look just like what we've experienced in medical school so far. And I think the pandemic has really shown us that we as a field, that we as a profession are incredibly adaptable and that we can do things differently than we've done them in the past. And neurology is likely to change, and we really want residents who are excited about all of those changes that are coming in our future.
If I have a question about, how to use the new doximity video, I have a co-resident that's already figured it out yesterday to help me figure it out. So I always feel like there's support here, which is the most important to me.
Culture of education, the culture of community, the culture of mutual respect at every level of the medical community. That is something that is really unique to the University of North Carolina in general, in terms of their philosophy of the university, but right down through the medical center, is that everybody is an equal, everybody has a voice.
The type of patients that we see and the type of neurological problems that they have, I've never seen anywhere else in the places I've been. For residents who would want to come here and train, and for those of us who stay here to practice, it's very, very, very interesting to encounter and take care of and try to manage diseases that you've only read about.
We are the public institution for the state of North Carolina, which means that we're serving the underserved. Our doors are open to everybody, and that means getting all of the diversity of the population, all of the diversity of the medical problems, they're all going to show up here. And we have to be at a level ready to treat anyone and everyone.
The motor that is everywhere on our hospital, built for people of North Carolina, by people of North Carolina, I really love that. I thought that I appreciated the idea of taking care of not only population who come to us, but population of the whole state.
It's becoming increasingly evident that we live in a very difficult time right now, not just with a pandemic and not just with racial disparities and all of that. We just live in a time where kindness and compassion needs to be up front and center. And so that's first and foremost, is that we want to have residents that embody that. If you put that first and foremost, everything else follows behind it.
The soul of the program is the residents. We're looking for your passion, we're looking for your interest in us, and we're looking for you to grow with us as we grow with you, and elevating you to new heights, and then sending you off to your career with excellent clinical training, impeccable clinical training, but also finding little teeny loves within a neurology that will fulfill you in the future.